would you like?
I have
Middle or edge?
literally no preference.
It looks good. Why not there?
Why
Yeah,
not, Chris?
Do you want us in any particular order?
I think if we just leave one on the left for when Rosanna
you leave
comes
this one
in,
for Rosanna?
and then
Yeah.
otherwise
I will
that's
sit in
fine.
the middle.
Yeah.
And do you want to sit there?
Perfect.
BACP.
Great. Have you all been mic'd up? Hello, everyone. Can you hear me? Yeah, great. Hi, I'm Parth Patel. I'm a senior fellow here at the Institute for Public Policy Research, and welcome to this timely event, I think. The scale of the mental health crisis is really quite hard to get to grips with. You know, in the past week, 1 in 6 people had a mental health problem, right? It's quite crazy. It's one of these great challenges of the 21st century, and one that I don't think anyone's really grasped the nettle on. So that's why we're having this conversation. And in one way, the pandemic's made everything so much worse, and prevalence has gone up, and I'm sure some of the speakers here today will tell you a little bit more about that. But on the other hand, we're going to ask, is this potentially a turning point? Can we use the pandemic and what's come out of it as something to really start grasping this challenge and thinking about mental health and access to care? And we've seen this sort of rise in incidence of mental health conditions and a decline in access to mental health care services. And that's a tragedy. Okay, so let's think about that. And I've got an excellent panel here with me to help process some of that. So on my left here is Mark Rowland, the Chief Executive of the Mental Health Foundation. We've got Hannah Davies, who's the Health Inequalities Lead at the Northern Health Science Alliance. On her right is Chris Thomas, who's the Head of the Commission on Health and Prosperity at the IPPR, and he's also my boss. And on his right is Fiona Valentine-Dykes, the Chief Professional Standards Officer and the Deputy Chief Executive at the British Association for Counselling and Psychotherapy. I'm going to say a quick thanks to the BACP for sponsoring this event alongside the UKCP and the British Psychoanalytic Council. Sorry, there's a lot of letters there. We're also going to be joined by Rosanna Allen-Khan, who's going to join us, I think, in the next 10 minutes or so. So when she does come in, we'll make sure that you, as the audience, get a chance to engage with her as well. She's going to be here for about half an hour before she goes back to the floor for the leader's speech. I'll try and wrap up about 10, 15 minutes before 2, so whoever does want to get to Keir Starmer's speech can do that. Okay, right, without any more rambling from me, I'm going to hand to Chris to kick us off.
And it's a lie. Parth's definitely my boss. I think he calls the shots, so definitely worthy of the chair seat. I am coming to this conversation from, as Parth says, the Commission on Health and Prosperity, which is an IPPR initiative that is incredibly interested in what's going on in health, but also that intersection between health and national prosperity. Our hunch, our hypothesis, our formative thesis as a program is that a fairer country is a healthier one, and that in turn, a healthier country is a more prosperous one. I think that last statement has often been forgotten. If we think about where things get blocked, where policy change that we know is good change, that is very human change, good for the economy, has a great ROI, strategic investment, that's where it gets blocked. So that's what we're incredibly interested in. And so I don't think there's many more important topics. I don't know if there are any more important topics that we could be talking about if that's the frame. As has been alluded to, we are sat here at a point where, in terms of mental health, access, outcomes, experiences, things have got worse. And in terms of the consequences of the COVID-19 pandemic, we're facing a very difficult set of indications from the data. So some of those are well known. We know, kind of numbers like 1.2 million people waiting for community mental health services. We have put out analysis this year, which just indicates the scale of demand that are now on children's mental health services. So from those being referred for self-harm through to eating disorders. Those numbers are very shocking. But I also wanted, and aware I'm going first, to put some provocation out on just the economics of that challenge as well. So a few things to highlight from that source of data. Firstly, that we know from 2021 data that if we're comparing unemployed people with those that were at the time either in full-time employment or on furlough, we know that unemployed people were by far significantly more likely to have a mental health problem or challenge. 2016 analysis found that around 200,000 people were excluded from the labour force because of their mental health, avoidably, so a big number. And that if we were to if we were to be able to solve the impact that the mental health was having on GDP, then GDP would be £25 billion higher. And we think about all the conversations, I'm sure, day 3 of conference you've all been having around what can be afforded, what can growth pay for. Well, there you go. There's a really good indication. And now more recent research. So let's look at what we've been seeing in the data from the last quarter. We've seen a really, really, really alarming spike in the number of people who are economically inactive, who want a job, people that say they're both economically inactive but would like a job if they could have one, that put that reason down to poor health. And within that category, mental health is one of the, say, 3 dominant categories. So we face a challenge. I think what we need is policy that really accounts for the span then of the value of mental health. We need to be much better at putting in place policy that realises the huge value that good mental health can have for the country as a whole, from a human level for individual lives, but also for that national prosperity case. That's why we've been, at IPPR, big fans of the idea of better access to treatment, of universalising mental health care in a much better way, of parity esteem, of making sure that in places like schools and other parts of public services, there's clear access, good use of the workforce that's available to the benefit of mental health through the life course. So I'll leave that there as a little bit of provocation. I'm sure others will dig into some of the detail and some of the more specific policy agendas. I'm looking forward to hearing what everyone thinks and your questions as well. But thanks for joining us, and looking forward to hearing what everyone else thinks.
Thanks, Chris, and really a great, interesting set of remarks to kick us off then, that sort of economic case. That just seems like, why are we not kicking the ball in? Fiona.
Thank you. I really appreciate this opportunity to talk to you all, and thank you for your setting the scene. As Parth said, I'm Fiona Ballantyne-Dykes, Deputy Chief Executive at the British Association for Counselling and Psychotherapy, BACP, much easier to say. I'm also representing the UKCP and the BPC, also mentioned, and we've got Adam Jones and Ellen Dunn in the audience here from the UKCP. I want to set out the case today for why our workforce needs to be part of Labour's mental health policy programme going forward to address the long-term impact of the pandemic and the growing psychological impact and economic impact of the cost of living crisis. The mental health impact of the pandemic has been hugely evident as the nation emerges from a toxic legacy of changing work, changing education, changing family circumstances, financial insecurity, isolation, extreme cases of bereavement, and the prolonged uncertainty that many continue to feel, both economically, globally, and socially. Data from our own public perceptions survey this year highlighted that 70% of people believe that their mental health has been negatively impacted by the pandemic. And most of those same people, 68%, think that the government has not done enough. Only 14% believe that the government adequately supported people with their mental health during the pandemic. So over the past 6 months, rather than seeing improvement, we've begun to see increased anxiety and depression as the cost of living has begun to bite. And our very recent research last month shows that 60% of our members are seeing clients cutting back on therapy sessions because they can't afford them or they have to reduce the number that they can afford. And that's a very worrying turn, because we know we're already picking up people who are falling through statutory services, both in the private sector and in the third sector. So it's clear that tackling this crisis will require public investment, both statutory and non-statutory services, so that there can be earlier intervention. And that's something I was talking about somebody just now, that counsellors and psychotherapists have a critical role to play in providing those services. Between us, our three organisations, we have 70,000 members. That's a lot of people. And we believe we can be part of this solution. We know, because we've analysed the data from our own members, that a lot of therapists have capacity to take on more work, up to nearly 5 hours a week, which amounts to £260,000 when you put all that together. But there's no money to pay them. So we have a capacity issue because of the cost, not because of the lack of skills. And as we see the light at the end of the tunnel of the pandemic, we also need to see progress in mental health provision. And this means tackling the issues of choice, different types of therapy, access, and waiting times. So while mental health was worryingly absent during the Conservative Party leadership contest, we were encouraged to see the ABCD plan for patients launched by the Health Secretary last Thursday, which includes a proposal to enhance mental health services. But this takes investment, workforce development, and we are concerned that the existing plans that were in place for the 10-year mental health plan could have laid some important foundations here, and this appears to be shelved. We therefore urge Labour to put pressure on the government to continue with this commitment. We are pleased to have worked closely with Rosanna's team and predecessors who have acknowledged that much more investment is needed to address this crisis. We have a shared ambition to improve the mental health support, particularly in schools, which Chris has already mentioned, making a trained professional counsellor available in all schools, which some of the nations have already achieved, but not in England. We also are pleased to welcome Labour's commitments to guarantee mental health treatment within a month, to additional recruitment to grow the growing mental health workforce, and for mental health to get a fair share of the cake when the funds are handed out. So again, we believe counsellors and psychotherapists can play a part in achieving these ambitions. Workforce expansion is cited as one of the biggest barriers to delivering this. And although there have been some honest attempts to increase pathways into the NHS, recruitment opportunities are still limited for counsellors and psychotherapists. And that means that a skilled workforce is not being used where it is needed at the point of need. We'd therefore like to see an enhancement of counselling and psychotherapy within the NHS. So counselling and psychotherapy can and does change and in some cases save lives. It needs to play a greater role in the health service, but also in lots of other settings, and I hope to say more about that later. And I look forward to picking up more detail in the Q&A session.
Thanks very much, Fiona, for those brilliant remarks about the role of counsellors and psychotherapists in our society. Hannah.
Thanks. I'm from the Northern Health Science Alliance, and we represent 24 NHS hospitals and universities across the north of England. So I'm going to be talking from a northern perspective. We do quite a lot of work on health inequalities because we recognise we've got lots of experts on health inequalities in the north of England. And also we have some of the greatest need. Over half of the north has a worse healthy life expectancy than the worst area in the south. So we're talking scale, which is why we've focused a lot of energy on this work. And the CEOs of our mental health trusts recognise the relationship between deprivation and between poor mental health. They see it on the ground the whole time. And over the course of the pandemic, they saw this worsen dramatically. We did a report on the impact of COVID in the north, where we found that COVID deaths were 17% higher in the north of England than the rest of the country. Hospital pressure due to COVID was 10% higher in the north, and the north spent 6 weeks extra in lockdown. So, as you can imagine, the impacts all of this has on mental health across the north of England was massively significant. So we did this report, which I urge you to have a look at. I've got a few copies, and please do pick it up on our website. And we found that the North, over the course of the pandemic, had 12% increase in antidepressant prescriptions. People in the North under 35 were more likely than any other age group to develop a psychiatric disorder, an increase of 2.5%. And ethnic minority women in the North had the worst mental health outcomes throughout the pandemic. Their mental health scores fell by 10% at the start of the pandemic and remained 4% lower. In regards to deprivation across England, the gap in mental health between the better off and between the most deprived widened significantly, by fourfold in fact. And the economic price, so I'm very pleased with Chris's work on prosperity and IPPR's work on prosperity and health, because we found in this report the economic cost, and this is a conservative estimate, of mental health conditions developed in the North over the course of the pandemic is £2 billion. So if we're looking at tackling productivity, this is a massively significant number. And also, the most vulnerable children across the north of England have been massively affected by the lockdown. 23% of parents said their children were lonely, compared to 15% in the rest of England. 55% of parents said lockdown had caused them and their children to feel significantly more depressed. And again, the long-term mental health conditions developed by children in the north over the course of the pandemic is estimated, and this is all academically backed, to be £13.2 billion in lost wages over their lifetime. So what can we do? Well, there's a lot of experts here who know a lot about this, but we must increase NHS and local authority resources for mental health research, specifically targeted at areas of deprivation. And we must build resilience in the population by tackling deprivation and the causes of ill health in the most vulnerable communities through increased health and social care support and benefit payments targeted at the most vulnerable in society. Thanks.
Thanks, Hannah, for running through the staggering scale of those inequalities across regions and social groups. We've clearly been joined by the Shadow Cabinet Minister for Mental Health, Rosina Allen-Khan. So, Rosina, I'm going to come to you next. We've heard... okay, fine. Well, I'll tell you what we've heard so far. We've heard Chris talk about the economic case around improving mental health, and Fiona telling us about the workforce, particularly counsellors and psychotherapists. And Hannah's told us about the scale of the inequalities.
Fantastic. Sorry, I feel like Janet Jackson right about now. Need a little headset, do a little dance. It's not clicking. I'm just going to sit with it on my lap. Okay, hi everyone. I'm Dr. Rosina Allen-Khan, and I am very proud to have had for 2.5 years now the portfolio for mental health for the Labour Party, and I am also a practicing A&E doctor, and it's great to be here today with people who are the real experts and who help inform policy ideas that I try and take forward. And it sounds as though you have heard lots of the things that I would normally talk about, which is that inequalities are a huge driver, and that adverse childhood experiences and inequalities are the single biggest driver of mental ill health later on in life. That it's a false economy not to invest in mental health. And you know, for example, I was at a loneliness event earlier today, and we know that although loneliness isn't perceived to be a mental health issue, it actually is as detrimental to your health as smoking 15 cigarettes a day. And the potential that it has to also cause mental health issues is huge. And so it's a false economy not to invest in mental health. It's a false economy not to have a cross-departmental, cross-governmental approach to tackling mental health. And actually, it was good to hear Sajid Javid talk about the government's proposed 10-year cross-government mental health and wellbeing plan. However, I fear that that may be scrapped. We haven't heard that officially yet, but there is word on the grapevine that that's going to be scrapped, which is a shame. It's also a shame that I still don't know, a couple of weeks on now from us having a new Prime Minister, who my opposite number is in government, which worryingly makes me fear for the consideration that they're taking towards mental health and any sort of hope of parity of esteem. And we know that what we've seen, even before the pandemic, has meant that, I mean, look, the NHS is not on its knees, it's flat on its face. And I know that there are many, many counsellors in this room today who do incredible work, and I have first-hand experience of needing to rely on people very closely. And firstly, thank you for all that you do, and obviously thank you to IPPR as well. And it has been a testing time. What's been so unique, I think, about the pandemic period and the post-pandemic period is it's been an incredibly testing time, not just for service users, but for service providers as well. I think people have had to step up in the way that many of you would have had to, even dealing with your own grief and dealing with your own struggles and your own loss and your own sense of how you manage a pandemic. So we know that going into the pandemic, the state of mental health services were terrible. We know that the need as a result of the pandemic has increased drastically. I mean, even just after the first wave, long before anything else, we had research that showed us, the Centre for Mental Health showed us, that up to 10 million people were going to need extra support for their mental health. That was before we even got into the second wave and the rest of it, and 1.5 million of those being children. So the situation that we find ourselves in, you know, the government will say, look, well, you know, we've pledged 2.3 billion, but that was before the pandemic. And every single time I have a debate with them, they spend that same money over and over again. So if we're in a debate about eating disorders, they will say, oh yes, well, we've pledged 2.3 billion pounds. In fact, the NHS asked them for 2.6. So there's still a shortfall, and that was pre-pandemic. So they spend it by saying, yes, well, we're going to spend 2 billion, eating disorders, yes. And then you go into a Westminster Hall debate about IAPT provision. Oh, yes, but we're going to spend 2.3 billion. 2.3 billion pounds, we've pledged it. Then we go into something about CAM services. Oh, yes. So they spend that. I mean, they probably spent it 5 or 6 times over in every debate that we have. And so I got to the point where I now start saying, I know you've spent this multiple times to me. Can you tell me exactly what money's going into what? But ultimately, you know, I sit here and talk to you about all these things, and you have all these incredible experts. What am I going to do about it? Is the real question. We're at Labour conference. What have I got to offer? What has the Labour Party got to offer? And I think that the policies, and for those of you that are around, quick pitch, those of you that are around tomorrow morning at 10 o'clock in the main hall, I have the mental health speech where I'll be outlining some stuff. But just really to let you know, prevention is our big buzzword, our big sort of theme, because that's what it's all about, isn't it? It's all about prevention in mental health. And in terms of policy that we've already announced and that I'll be talking about again tomorrow and that I have been talking about at all these events, is that we know that with mental health it just isn't about apps and equipment. It's about people. It's about having a workforce that can be there in a quick and timely manner for people that need it. And so we pledge to grow the workforce by 8,500 new mental health members of staff by the end of the first term in office, in order to be able to guarantee people mental health treatment commencing within a month. And that is so ambitious, and people say, what are Labour doing about it? You're not doing anything about it. And then you say, this is what we do. Oh, you can't achieve that. But the reality is that that's what's needed, and that is our real aim. And we know, and many of you will know, because you'll be meeting many people who've been waiting for an incredibly long period of time. We know that it's a postcode lottery currently as to the services that you can get, especially for CAMS. We know how many people have a really solid referral from a teacher, from a GP, from a counsellor for extra help and support, and then it goes somewhere and then it gets shut down before anyone's even seen. There hasn't even been an initial consultation. Or there's an initial consultation and then they have to wait 6, 8, 10, 12 months, 2 years. Some people wait over 360 days, and that's not acceptable. So that's why our ambitious target of starting treatment, not just an assessment, but starting it, whatever that is, whether that be the need for medication, no judgment if people need to go on medication, whether that be talking therapies, CBT, whatever it is, that will commence within a month. Also, we will have a counsellor in every school. everyone will know that we have to get on top of the issue of children's mental health, and that we can only have a generational shift in terms of people having the hope of fulfilling their potential later on in life if we're able to give them the proper mental health support that they need it when they're children. And all the work that I've done in the last 2.5 years, all I hear from schools is that they're having to choose between a counsellor and books. And sometimes they're lucky and they have organisations like Place to Be in the school able to offer help and support, but that isn't mandated. So we would guarantee that. We also know that not everybody can go to someone in their school. Not everybody can go to someone at home. We know that home is a place of deep instability for so many people. So that's why we would have an open access mental health hub in every single community. And there are places where that's happening already through charitable initiatives, and the evidence is that it's really, really good, really easy for people to access, Mind and Co-op together, have a really great partnership. There's an open access mental health hub in Croydon that I've been to that is really, really good. So we know that this works and we know that it's needed. But also it's about having the understanding that that mental ill health affects any age and stage of life. We can't forget anyone at all, whether you are pregnant or have just had a baby and are suffering with postnatal depression, whether you have a parent with dementia or early onset Alzheimer's and you have to choose between giving up your job and caring for them. You have your mental health needs, their mental health needs to consider. There isn't anyone at any stage of life, menopause, if you look at women who struggle with their mental health and who never get a proper diagnosis, who go years and years and years waiting just to find out that actually if they'd had some HRT or had proper access, they might not have felt as though they needed 3 friends to peel them up off the floor and stop them taking their own lives. So we have an imperative to get this right. But you know, everyone always likes to frame things in terms of the economy, and I know you've spoken about that already, but 18 million work days were lost in 2021 due to mental ill health. The impact on the economy is huge. So I will just end by saying that we have to be hopeful. We always have to be hopeful that there is a way forward, and I think we're all here together because we have a shared view and a shared hope for what is possible. And I would just like to thank all of you that have worked so hard in your various fields, in your various areas of specialism in mental health over the last 2.5 years to get people and our communities through what has been the very darkest of times. And my door is always open and I'm here to help as well. Thank you.
Thanks, Rosanna. And there's lots in there. I think everyone sort of agrees the scale of the impact on people's lives and the economy is massive, and is Labour's offer by at least starting to get to grips with the scale of this challenge. Maybe we'll come back to the Q&A, but before we do, Mark.
Thank you very much. And following my distinguished guests, it's always hard to go last, but my name is Mark Rowland. I'm the Chief Executive of the Mental Health Foundation. Massive fan of the therapeutic community as a discipline. Been in therapy myself twice at 2 really important stages of my life. I'm such a fan of therapists that I married one. And so, as Rosanna said, I think it's an area of professional discipline that has been undervalued in our society, and the roots of what the sacred space that therapists provide is something that we need to look at about how do we extend the access and opportunity for people, but also how do we take the active ingredients in a non-clinical setting as well, because I think there's a lot to learn from the power of what happens in a therapeutic context that we can replicate in non-clinical contexts. And I want to talk about that in the context of the prevention of poor mental health, because what is clear is that however many therapists we train, even if we train the 8,500 workforce, it won't meet the rising scale of demand of the distress that is in our communities. So we do need to think quite profoundly about what Rosanna talked about in terms of how do we effectively as a society prevent poor mental health. In every other area of health around the world, especially in acute care, in infectious diseases, and in acute healthcare, we are seeing better health outcomes. Numbers of children dying by the age of 5 has plummeted in the last 50 years. Our response to cancer has dramatically improved. but we've seen no such commensurate increase in relation to mental health, and this was pre-pandemic. In terms of the overall prevalence of poor mental health, we are still working out what the consequences will be, but it will be long term. We did our own study, a sort of a cross-sectional, repeated survey of people during the pandemic, and we found particular groups were at risk. But we are waiting, and it will be really interesting to see the APMS data, which is a 7-year study of the prevalence of poor mental health, and that will tell us the definitive story of the mental health consequences. But we know it's going to be long-reaching. There were 4 groups in our study who were particularly affected by the pandemic. We saw students and young people. We didn't poll younger people, I'm sure we would have found, but students, young people, higher rates of anxiety, higher rates of suicidal ideation, higher feelings of loneliness and despair. People with long-term physical conditions, people with existing poor mental health, and single mothers, single parents. They were 4 groups that kept on coming up, and when you cross-referred those groups in relation to ethnicity and poverty or LGBT status, the risks accumulated. So we've got to take, in any response, we've got to understand who is at risk and how we customize our response to meeting where the needs are most acute, because the playing field is not level. Let me tell you that there were some people during the pandemic whose mental health dramatically improved. We saw people who were of a middle income, in stable relationships, who were spending more time with their elder children, who had a great time during the pandemic. So it's not just that, but what the pandemic showed us is that if there is anything we need to understand about mental health, it is fundamentally malleable by our circumstances and environment. And that means that there is much more that we could be doing to support good mental health, protecting our mental health. We must do it. There is this massive, urgent case on a level with the climate catastrophe that we must create a society where it's not such a struggle to get up each morning and feel good about oneself, one's job, one's place in the world. When we surveyed the UK population a few years ago and we asked people how many of you are living with a good mental health, really thriving, and we're not talking about kind of bouncing off the wall happiness, we just get up in the morning feeling good. 13% of people said, yep, that's me. I think that's a tragic judgment on our society. So we've got to be doing much more. When we looked at, and we also did an economic analysis with LSE on the economic case of prevention. We wanted to really understand what we were trying to solve. Across the UK, when we took a conservative look at the costs of poor mental health in terms of presenteeism, lost productivity, the cost around informal carers in particular, and the cost to mental health services, the figure that LSE and us worked out was 117 billion. The total cost of the NHS is 150. So and when you look at this, mental health is 30% of the illness. So if we want health creation to be the heart of the Labour's policy, mental health has to be like a really big part. And it really does require us to think differently. There's not going to be small changes that is going to make a difference. It's going to be a fundamental rewiring. And that's why this cross-government plan for mental health is just, it would have been a world first, and I think if it doesn't happen, then Labour's well positioned to pick up that mantle and show the way about what kind of commitments would happen outside of the health service that could help and protect people's mental health. I think I just want to talk about what I understand happens in a therapeutic context, what is so incredible in terms of effectiveness, and it's something about the safety of a space where you have this unconditional positive regard, someone to listen without judgment. And I think we need to be ensuring that is available in a clinical context to as many people when they need it. And we need to be thinking through how could we create those kind of spaces in community contexts, in schools, in workplaces, in the places that people live, in family spaces. We run a program called Becoming a Man. It's not targeted at people with a mental health condition. It's targeted at people, young men who we know are at risk if we do nothing, and we just create a safe space for them to understand their emotional hinterland. And we need those kinds of interventions, which takes the best of a therapeutic context, but are making it available in a non-clinical for that sub-threshold group, which we're really concerned about, for whom if we do nothing, they will just be adding to the mental health burden in years to come. So lots to think about, and I'm sorry if I've gone on.
No, not at all. You hit a nerve, because I'm one of those sub-threshold folks and accessed therapy through the BPC in the first wave of the pandemic when I was working in A&E, so thank you for that. Right, we're going to open up to the audience. So, yeah, hands up for questions, and just say your name, and if you want to say where you're from, please do, and if you've got the question targeted at anyone in particular, that'd be great as well. So, can I come to the lady in the yellow shirt at the front here first?
Yes, I just wanted to ask you about prevention and the commercial determinants of mental ill health. Because there's often a false sort of, well, I would see it as a false kind of equation with the finance that is brought in through marketing to people in terms of increasing their difficulties, their mental health problems, because you can make money out of it. So gambling is one example of that. When we're talking 10% of all completed suicides. Yeah. And it's a kind of false equation, isn't it, really? Because I realise that somebody like you or Wes will have to make the argument to Rachel Reeves. And it's actually a debate that has to then happen. So what's really important is to understand that that kind of prevention is good for the economy and good for jobs, because that ends up being the argument, as well as being the huge harm. You know, for example, with gambling, we're talking about 1/5 of the population being seriously harmed. So either by being addicted or by being somebody who's around somebody who's addicted, who's harmed. And the lack of knowledge about that in therapy, and the degree to which it's very individualized and seen as an individual person's solution rather than the systemic changes to address the commercial determinants of that. So just, it's a pretty difficult question to give you all.
No, thank you. It's an important question. Can we get hands back up? We'll take 3 at a time, sorry. Should we go just to the person right next door?
Hi, Adam Jones from the UK Council for Psychotherapy, supporting this event today, and thanks to all the speakers. You've been amazing. This was actually a premeditated question, which has been touched on massively by Rosanna and Mark in particular. But I do kind of want to probe at it a little bit, because we've been sort of inadvertently following Rosanna around fringe events the last couple of days.
We got our steps in, haven't we?
And just it's been amazing to hear consistently Rosanna talk about the value of investing in people's mental health, the social value, and also the economic value. And actually, you touched on it there, making that case to Rachel Reeves and with her strict fiscal rules, I think is so important. But I guess there's this kind of history of and it seems like a Labour government is more plausible than it's been for some time. But there's a history of government departments being incredibly siloed in the way that they manage money in partnership with the Treasury. And I just want to know about kind of how you make the case for investment in mental health, not just to make savings in the NHS, but to make savings across government departments. And I'd love to hear about your plans in that area, because it's so important. And as Mark's touched on, you know, therapy is life-changing. I mean, I'm sure there's loads of us in this room who've experienced that, and that just has so many benefits in all areas of life.
Thanks. We'll take one more question. We may as well stick on the front row. We'll come to the next rows in the next round.
Hiya, I'm Kathy Churchill. I'm a postie from down south. I'm one of the people you've talked about. In the last 2 years, I'd say I've probably cost a Royal Mail 8 months' wages for various times having to have time off sick. And my question, or a way of a question, is in 2 parts. Part of it was due to my mum being ill and being scared to go to the doctor during the pandemic. She just passed it off as her arthritis getting worse when really it turned out to be cancer. And during that time she was in hospital, Obviously, it was during the restrictions. Only one person could see her, so it was my dad. It made sense. But for her family, although we're adults, it meant that we lost all that time with her. And in that build-up to her death, there was no offer of support to us. It wasn't until after she died that we could get support, and then we had to wait 6 to 8 months to get it, apart from a charity locally that offered minimal support in the meantime. So it's offering support pre-bereavement to people where we know that's the outcome. And the second part of my question is to do with businesses and my work. A way of stopping businesses, I don't like saying it this way, but virtue signalling that they're helping with mental health. But when you really go to access what they're providing for us, all you've got is a crisis line. Royal Mail have fitting first class. You ring up, I did it. What help can I get? I need help now. It would have kept me at work for longer. I would have had less time off, but no, all it is a crisis line. So you feel like you've got to be suicidal before you ask for it. Yeah. So it's how can we help those people like me so they don't go through what I went through as badly.
Thank you, and thanks for sharing that. So we've got a question about commercial determinants in gambling, Labour's cross-governmental approach, and the question about bereavement support and what could workplaces do. Reza, I'm going to come to you first.
Yes, sure. All fantastic questions and really, really important. And I actually had the gambling brief before I had the mental health brief. Yeah, and you're absolutely right. I do think we have a duty, a moral duty, to take a public health approach to mental health, and that includes dangerous, harmful behaviours and practices like having, we've worked very hard on it, but sort of gambling adverts at football matches and sponsorships for football teams and sort of normalising gambling. So that's my argument to have with Rachel. And I'm not afraid to have it because I'm not in this job. I'm not a career politician. I came from a background completely unexpected to fall into politics. So I'm not afraid to say what I think is right, and I'm not afraid of anyone's rules. I will have the argument. I don't know where we'll get with it, is the honest truth, but it's about presenting evidence and the economic evidence for it. And just yesterday, thank you. And just yesterday I was at somewhere called Paul's Place in Liverpool, where they support people who are bereaved through suicide, and they actually explained how many people lose their lives because of gambling, but then for those who are bereaved from suicide, just how many of those go on to gamble and then subsequently take their own lives from a bereavement loss. So absolutely couldn't be more aligned with you and what you're trying to do. The case, it's been lovely. It's been lovely being around conference with you, and absolutely sort of the cross-departmental approach. So I've been doing that all along the whole time I've had the brief, trying to work with colleagues in housing, colleagues in education, basically colleagues everywhere. And I think that you cannot. I mean, the 117 billion, which I'm going to reference tomorrow as well, the 117 billion cannot be ignored. And it's all very well and good talking about a fiscal responsibility and but it makes, it's a false economy. It makes no economic sense not to invest in mental health. If you look at absenteeism, presenteeism, days lost, all of it, it is a DWP issue. It is a industry's issue. It's everybody's issue. And businesses, I believe businesses, and I speak at a lot of business events as well, businesses need to get it right, because for their productivity, they want a workforce that is switched on and engaged. And I think that actually, just moving slightly on to Kathy's point, Kathy, I'm really sorry for your loss. It's incredibly difficult, and I know the feeling of feeling robbed of time over the COVID period. Full disclosure, went through that myself. So it is crippling. And just this morning, I was speaking at a bereavement round table and talking about the importance of offering bereavement support before you've even lost someone. Because there's a very unique set of circumstances around watching someone that you love fade away slowly, and also not being able to be there, or the trauma that you go through being at someone's bedside for a week, watching them slip away and being part of it all. It's highly traumatic. But that has to be supported, and not at the expense of having proper bereavement time off work that's mandated in law after as well, after someone's passed away. and as well, if you've had a long time, there is no, I always say this, that there is no hierarchy of how someone you love passes away. It's not, people will say, oh, sudden's better, died in their sleep, or it was long and, like death by 1,000 cuts. A bereavement is a bereavement, whether it's sudden or whether it's long term. Each comes with its own individual issues to deal with. But I do think that it is really at the mercy of employers and what kind of employer you have as to whether you feel like when you could go back to work. I remember I didn't feel fit to go anywhere after I lost my dad, but I felt that with the job that I had, that if I didn't show up to things, people would say I wasn't doing my job properly. I didn't feel I had any space not to show up. So I was going to things a week later while trying to arrange a funeral, crying in my car, showing up, trying to rally the troops for something because people had said, oh, where is she? She's not showing up. But I didn't feel like I could say to people, I'm struggling to get out of bed and my kids are sad and I don't know what to do and I feel robbed of all of these months. I couldn't say that to anybody. Whereas other colleagues who were sort of more protected by the system, it's like, oh yeah, well their mum's died and so they won't be in for 3 weeks. It's like, well, where was that for some of us that needed it? So I think we absolutely have to, I think we need a structured, and that's for me to take away and look at, but I think we need a proper bereavement package and time off that people don't have to fight for or worry about losing their job or worry about the stigma around any of it. And the crisis line, you're right. I mean, what's the point of having a line? And there are some people that do fantastic work with that, and that's enough for them, for some people just to have someone to talk to. But you need to know that you picking up that phone, being vulnerable, picking up the phone and getting someone in the end is going to result in a certain number of sessions and support, and not someone saying, oh, actually, wait 6 months until you've got over this a bit, and then you can start seeing someone. So I know I'm being summoned.
Thanks. Yeah, you're being summoned.
I'm being summoned.
But thank you for those comments.
Thank you so much, all of you. Honestly, I've just really, really enjoyed spending so much time with all of you, and I learn from you. So thank you very much for all the input that you give me so that I can do the job the best I can.
Thanks for joining us.
Very much. Thank you.
Good luck tomorrow.
Thank you.
Chris, I'm going to come to you next, and may specifically sort of target how does Labour's society and Labour's economy look to improve mental health, that cross-governmental approach?
Yeah, that's throwing me the hard questions, Path. So I think there's a few things that I've picked out from those questions as themes that I think Labour should be thinking through. I think the first is that there's probably an alignment between the health and economic arguments. And I noticed it was talked about there as an argument. I don't think it necessarily has to be an argument. I think it can be a kind of enlightened alignment of interests from a Labour perspective, which is to say that I think we've seen today that there's an opening in the Shadow Treasury team for health policy, good ambitious health policy to be economic policy. It was very telling that it was a Rachel Reeves announcement yesterday on the NHS. We go back 12 months, that was a Keir Starmer announcement. So I think it's a telling sign that actually the economic case is getting there. And I think if Labour have that at the heart, then they're only going to make better policy. I mean, they're cheered in that by just the sheer potential in the data. So we've talked a lot about kind of how can Labour position their mental health offer in terms of things like time off work or sick leave. I think there's even better, more exciting arguments that we can talk about. We know that good health, and this is something the Commission is very interested in, isn't just about how much work you're doing for your employer, it's about how good your job is, what your ability is to get on at work, whether you're enjoying doing that work. So that's the prosperity word rather than purely, we could have called this a commission on health and wealth. But I think that prosperity word is important. And I think there's an important consideration for Labour in terms of putting this across, which is their approach to working with business. We know that the word partnership has been used a lot, but I was very struck by the gambling question, which kind of gets to the heart of, I think, the give and take, which is that there's a really conductive relationship here that's in line with the partnership point, which is that it's good for society, for government, for mental health to be good. and it's good for business for mental health to be good as well. But when things are not demonstrably socially valuable activities, then I think there also have to be expectations, there have to be bottom lines. And I think if you were to talk to those that speak across business, they would say the same. That's a small sector that are profiting in a way that undermines both individuals and other businesses and government, society, and the economy as well. So I think there's much that can put mental health across a collage of policies. I think there's big opportunities for it to be considered not just a siloed issue, that's kind of left to the side, but can be put at the very heart of the economic plan for the country. And I think there's encouraging signs that puzzle is starting to be connected. So some thoughts on that from me.
Thanks, Chris. Lots there to chew over. Fiona?
Yes, I did want to come back. I remember sitting in parity of esteem conversations probably 10 years ago now. And I also remember trying to complete a study to show the economic benefit of therapy being available. But the evidence is so strong now. And I think the theme that's really come through when some of you were sharing your experience was that you actually know when you need help. You don't need to wait until you reach an IAP threshold or whether you've reached a crisis that take you into secondary mental health systems. You know that you need things earlier, and it's how you access that. If you're lucky enough to have an EAP which might offer something, or if you're lucky enough to be able to pay for your own therapy, then maybe you can do that. But the vast majority of people don't have that advantage. They can't access services, and I would see that as one of the absolute imperatives about freeing the system up for people to access help when they need it. And I also particularly like your point, Mark, about what other things can we do, because it's a social issue, it's an economic issue, it's not just a health issue. And we have opportunities to share what we know as therapists. I'm a therapist myself, and to bring into other contexts so that people are supported at a much earlier point. And I think Kathy's question showed a lot of that you knew what was needed and it wasn't there for you. So a big shout out for the third sector, please, in terms of support, because that's where this type of help does help, and it's also more community-based, it's more locally sensitized to the local needs, whether those are particular groups of clients. And often those are staffed by organizations that are scrabbling to keep their funds together, that are trying to know what they can do in 6 months' time so they can't plan ahead. So security of funding for the long term for the third sector in local communities so that people can access the help that's appropriate for them at the point where they need it rather than when it reaches a crisis.
Thanks. Yeah, and I think as a doctor, there's really no worse feeling than making a referral for a patient to go see a therapist, knowing full well it'll be the best part of a year before they get to see that therapist. Mark, I know you wanted to talk about the commercial determinants of gambling.
Yeah, and the cross-government plan as well. I think where you see the commercial determinants in mental health, I think you're going to start to see it, and we really hope that we'll bring this online safety bill back to Parliament, because you can see, if you're following that Molly Russell case, that there is a real risk that the social media companies have a driver to produce content which may be legal but harmful, that drives user engagement. So there is a direct parallel with gambling, and we have got to stand up to the commercial imperatives that undermine and deteriorate people's mental health or put it at risk, and stand up and say, no, in a civilized society, we've got to have some really good regulation, and so it will be good to see that. And I think that's particularly important. I think therapists there are two cross-government plans at the moment. One is around mental health and wellbeing, the other is the suicide prevention plan. And I think the therapeutic community have got a really big role in suicide prevention. I don't know what the answer would be around, how many therapists do we have in the UK?
Well, there's 70,000 between the three of our organisations, and there are more organisations out there.
70,000. So it'd be interesting to know how many of the 70,000 working with their client have an agreed suicide prevention plan in place. And talking to a therapist recently, it definitely, having that suicide prevention plan in place was what saved their lives, because they weren't always available, but they knew the point of access, they knew the signposting, and so I think that is a tremendous potential for the therapeutic community to have a real impact in relation to basically helping people to be prepared. And my final part, because I won't go on, but just about the cross-government plan. We met with Stephen Timms earlier today talking about the benefit system, and the way in which we can get mental health into cross-government plans sometimes is about going to cross-government departments saying, this is the benefit if we do it this way to mental health. And sometimes it's about offering the mental health perspective to help them make the reforms that they want to. So Stephen Timms is working on a commission in relation to the benefit system and will produce a report. And some of those recommendations we would really support from a mental health perspective, like not having a 5-week gap to get your benefits. And we can provide a mental health justification for what is otherwise a very reasonable case. So sometimes it's just adding a mental health psychologically informed perspective on reforms that we know are good for the human being, and he was just like, yeah, if you can endorse that, that's great. It's just another. So I think we've got to think smart about how we integrate mental health thinking into wider government policy.
Thanks. I think that's spot on. No, I'm going to move on, but at the end of the panel, hopefully you can come grab. Yeah. Okay. Can we have another round of questions? We get hands up. Shall we go to the woman in the black jacket here?
Hello, I'm Emma. I'm from Randall's Monitoring, but I also am kind of talking as a leader of a Run Talk Run group, which is a global mental health charity. I run the one that's in Liverpool, but it is national. So it's a mental health running space, which basically acknowledges that it's cheaper and easier sometimes for people to just talk to people kind of while they're running alongside them. We just do a 5K down the docks, and people show up from all walks of life of different experiences. I just wondered kind of how you can get community groups like that promoted in other spaces, so in health spaces that exist or public spaces. Where can you kind of collate all of this information in these other groups that can be offered for free?
Thanks. Let's have hands. Okay, we'll go to this man here. Yeah.
First of all, a comment, and the comment is that actually mental health services save large organisations money. It actually doesn't cost them that much money. And I was formerly the head of student council at the University of Leeds, and we were able to prove that actually the cost of our service was more than covered by the amount of students that didn't leave the university because of mental health issues. So I think that's a very important thing to say. But my second thing to say is a question. And I don't know if anybody saw the recent panorama about how young people were affected by the pandemic. And actually the consultant psychiatrist at the Maudsley said that the single most important thing that any government could do to help some of the most disturbed and disturb young people in society was actually to extend the CAMS, the Children and Adolescent Mental Health Services, age limit from 18 to 25. That would make an absolute massive change to those young people's lives, because it will actually extend the services, which are actually very good, beyond the age of 18, when actually the developmental phase of adolescence goes way beyond 18 to 25, when actually the ages between 18 and 25 is perhaps when they are actually at their most vulnerable. And actually for a Labour government to say that they would extend that age limit would make a massive difference.
Thanks. Let's take one more question. Should we go right to the back, to the woman there?
Thank you very much indeed. I'm Kirsten Mchugh. I'm Chief Exec of a charity called Carers Trust. We're the national infrastructure body for the local carer centres all over the UK. We look at this from two perspectives. We support about 1 million unpaid carers, and a lot of those are caring for people with mental health difficulties. And of course, if they can't access the support, then that has knock-on effects to them, including about 50% having to give up their job because of their caring role. But also, if you are an unpaid carer, you are more likely to have mental health problems yourself. And when we bear in mind we've got about 1 million under 25s who are unpaid carers, and there's long-term lifetime scarring effects in relation to that. One of the things we've been playing with is whether we should be pushing for fast-track access, if you're an unpaid carer, to mental health support. Because if you fall over as the unpaid carer, then the NHS or the formal social care has to step in, thereby...
Went through a difficult time a few years ago when he became bedbound, and I think I had no support, and I struggled to get support. It was over the pandemic, and I think that would be brilliant to have that access. And it's something that's fine now, and eventually via doctors, etc., I got put in touch with social services. But I think it's a real need out there, and I'm very privileged in that I've got a great job, I've got a lot of flexibility in how I work, etc. But I know that people who are from more deprived communities, they have to quit their jobs. They don't have the flexibility of a professional wage, etc., etc. And understanding how hard I found it from a mental health perspective, but also practically, it's like incredibly difficult to be a carer. I think much more attention needs to be given in to supporting carers, and we provide billions of pounds of unpaid care, and it's fundamentally important that we don't collapse, because if we do, the whole system collapses, and we would cost billions in productivity to make up. So I think absolutely. Community groups, I think they're essential. I mean, I've done some work with the All Parliamentary Party group for Left Behind Neighbourhoods, and one of the reasons these areas fall behind is because they don't have community structures, and community structures can really help with people's mental health. They help all kinds of areas. So I think, yeah, let's look at anything we can do to help the park runs, the running groups, the just drop-in centres where you can go and have a chat with people. I think that would be an excellent thing to do as well. So yeah, full support for that. And yeah, I'll leave it at those ones.
Great. Chris, I'm going to come to you next, and maybe you can tell us a little bit about the work IPPR is doing on community organisations.
Yeah, absolutely. So, strong agreement, community solutions are integral, and I think there's an increasing understanding that if you want the best solutions, then it's probably not going to come from the centre in a top-down way. It's probably not going to come from necessarily even within institutional walls. It's going to be in communities and from people themselves. The question of how do we compile that, how do we make them accessible, how do we, kind of ensure there's consistency in that across the country is a really good one. I don't think I necessarily sit here with the answer, but we are doing a lot of work to try to understand that. So two things in particular. From a health and care services point of view, we're running a very substantial programme trying to understand what the future of those services look like, including a big deliberative programme within that with service users from across, including mental health services, but across lots of different areas on how we can redefine the public services piece. But we're also going into the places people live, so in Lambeth, in Salford, and in Leith in Scotland, to do a big programme of trying to understand what health means to them, what the infrastructure is that communities want to own, that provides a bedrock for good health, and also some of the other dynamics. So we're incredibly sold on the promise. I think there's more to understand, and we're doing that work to help understand. So it's a slightly unsatisfying watch this space answer, but hopefully better than nothing. The only other one I wanted to touch on was the fast pass, the kind of priority access piece, and I think the case for rapid access, you've put it so well, Hannah. The thing I come back to, though, that I wanted to throw in was we're all very familiar with lots of the founding principles. The NHS had the kind of Bevanite, free at the point of use, based on need, tax funded. The thing Bevan talked a lot about that often gets forgotten from those conversations was the whole point of the NHS, and indeed something he wanted to replicate in social housing was universalise the best. He talked a lot about universalise the best. And I think we're sat here talking about such compelling human health, economic, social evidence that the aspiration shouldn't necessarily be trade-off. Should there be faster access? How do we get fastest access for everyone? I think that's the level of compelling evidence that we're really dealing with. So that's not a no or a yes, but that's just a thought that jumped to mind instinctively from it. I'll leave it there, Pastor. Other people can come in.
Thanks, Chris. Mark?
Yeah, I will just come to your question. What was your name? Emma. Yeah, I mean, I think when I was talking about earlier on that we need to think more broadly about the community assets and how we can kind of replicate what is happening in a therapeutic space that works in terms of the safety of a space to be able to explore what has just happened. And a lot of our work is around the idea of peer support, finding one other person who has walked in your shoes and who can say, yeah, I know what you mean. I'm not giving any fixes, but I understand what you've been through is really important. And we know from the therapeutic, some of the modalities like EMDR, which is around this idea around bilateral movement, and it's really got a great evidence base, and it was sort of created by accident with this idea of bilateral movement, and it stimulates a reprocessing in the brain that allows people to deal with trauma. And the interesting thing about running is it's the same bilateral movement. So running and walking, in fact, some of the first EDMR was found with people walking with their clients. They took their clients away from the room to actually move, and they found that they could explore their emotional hinterland. So this is where we need to validate that it's more than just a run and a chat. You're actually exploring some areas around the cutting-edge neuroscience and mental health support. They've got a lot of the ingredients there that are working, and we need to get the best evidence we can. So we need to plug those kind of interventions into this system of social prescribing that we now have, so that services like that are signposted from whatever entry point you come into the health system. Because if you've got a physical health condition that would allow you to participate, you will benefit. If you've got a mental health condition, or if you're in that sub-threshold where you're struggling, you're going to benefit. So the question is around equal access, because in making sure that the people who really need it are able to engage, but take confidence from the value of that intervention. And it's exactly the sort of non-NHS intervention that we need to be scaled if we're going to meet the rising demands of the mental health crisis. It's exactly what we need to be thinking about: how we scale it, how we replicate it, and how we target it at those who most need it.
Great, thanks. And Fiona?
Yes, I think one of the themes that's coming out here is the interrelationship between early intervention, peer support, community activities, and then referral to specialist services. And I was struck particularly by the CAMS question, because I've had personal experience of young people falling between the cracks, where one set of services ends and the next one is inadequate for their needs. And the same thing happens even referral to CAMS. A counsellor in a school might have prevented a referral to CAMS. So it's about how all these things link up together, and multiple referral routes, an understanding of what those different interventions can be and can mean for individuals. Because it is important, even if you are in a sort of peer support role, that you also know what your limits are and that you protect yourself. Otherwise you end up with overload of people who are trying to support people which is beyond their ability, and that's a very important issue from an ethical point of view and a self-care point of view. So I think understanding the value of all these things and how they fit together would make a huge difference. So particularly on the carer thing as well, I was kind of reminded of the NHS and the social care. These systems don't exist separately. They need to work together, because as you said, if a carer is not coping, then a whole set of other systems falls down. But yeah, conversations, multiple referral pathways, understanding the value of those different interventions and knowing when to refer for specialist help, I think is a really productive way of thinking about it.
I think that's a really good point, and I really like the point about getting things to fit together. With carers, for example, access to mental health care services is one aspect, but access to better wages is just as important. Should we do any more questions? Has anyone got any more questions burning together? We could do a quick, maybe one or two. Okay, we'll have these two.
Hi, I'm Keith Edwards. I'm from East Devon, CLP. A little bit of this is a bit of a Groundhog Day for me. I feel as if I've heard a lot of it over and over again, having worked in the National Health Service, in mental health services, having taught, having researched, and I still find that all the people are using the language of mental health And I don't feel we're really coming to grips with mental health. I still feel that we're talking about ill health and mental illness. And when people, I know a few of you have used the phrase, what was it, mental health perspective. And I think, well, hang on, what does that mean to you as individuals, a mental health perspective? I know what it means to me, having worked in CAMS, having worked with families, and I still work part-time at a university, and a lot of students have problems. And the issue is mental health perspective. Well, what is it? And usually when I talk to people about what has happened to them, or what is wrong with them, what has happened to them, and they start talking about issues of poverty, debt, insecurity, especially in relation to housing situations and so on, having to work excess hours, in work poverty. These are the social issues, and these are the issues that give rise to so many mental health problems. And I feel when people come to what are primarily mental illness services, we're still not raising a lot of these causes of mental health problems and putting them right up there on the top of the agenda. Because it's the old cliche, if you like, that there we are at the bottom of the Mersey pulling the bodies out, and we need to get to the top of the river to find out who's pushing them in the first place. Mm-hmm. So again, I don't know what you think in terms of, well, what do we have to do to change the focus of the current situation so that we do put mental health right up there at the top of the agenda?
Thanks. Excellent question. And this woman here in the green chair.
Thank you. My name's Hannah. I work at UK Music, and earlier this year we wrote a report all about how music can help people's health and well-being. We use kind of examples from very small scale, people talking about how they, during the pandemic, turned to music, to listening to music in their bedrooms as the thing that got them through, to parents whose children were non-vocal until they saw a music therapist and started singing. So it was an amazing piece of research to do. And I guess Chris has touched upon social prescribing, but I was interested if the panel had any views on music therapy, arts therapy, and social prescribing, particularly given where we are, what the Labour Party could maybe do in any manifestos in the future.
Thank you. So we've got that question about the social and economic determinants of mental illness, and are we sort of ducking that by just focusing on service provision? And this lovely question about music. Hannah?
So deprivation, absolutely. It's ill health and ill mental health are inextricably linked. We know that time and time again. Looking at productivity questions, we found that ill health drives ill mental health. You can't really separate, we have to separate the two sometimes, but they are inextricably linked, and deprivation is again and again the main driver behind both of them. So absolutely, we need to tackle the social determinants of health, ultimately, and that's by creating better jobs, better standards of living, warmer homes, feeding children, secure jobs. I mean, the report we did for the Left Behind Neighbourhoods, all parliamentary party group, found that health conditions cost £23 billion in lost productivity, and they had far likely to be off sick. But they also worked an hour more on average than those in the rest of England. So there's this lazy narrative around benefit scroungers that we've all heard, but actually those in the most deprived communities work an hour extra on average than those in the rest of the communities, even though they're more likely to be off sick. It's the nature of deprivation. So that's really something that can't be separated. But when we're looking at treatments, we need to fund treatments properly. So we need to tackle it at the root causes, but we also need to fund treatments. And I think, yes, social prescribing is very helpful for that, building up community assets, but it needs to be funded. And we need a government that understands that funding these things is fundamentally really good for productivity.
Thanks. Fiona?
I want to come back to your question about what we mean, what's our perspective on mental ill health. And the fact is that you need a diagnosis to get help, basically, within a health context. Yeah. Well, even to get a counselling referral, or a referral to CAMS. And actually what we're talking about, which Hannah's touching upon, is more about social justice, matters of inequality. So the illness is not located just in the individual, but in the circumstances in which they're expected to live and work and thrive. And I honestly think that is such an enormous question that governments don't know how to tackle it.
Right.
It's not a matter for the health service. It's not just a matter for the DWP. It's not just a matter for the education department. It's, as somebody said earlier, it's a matter for all of us. And the size of the problem is so huge that I think it's almost a sort of psychological denial because it feels insoluble. So that was my reflection on that. I can't remember what else I was going to say now. That was the one that stuck with me.
No, it's a really, really important reflection. Thank you.
I mean, I think the challenge that you're making is common with all chronic health conditions, that we have a health policy system that is picking up the pieces, and we haven't and the problem with public health approaches is that they take a generation sometimes to come through, and consistently we've seen it. So we've got to make the economic case, but I think this is the next iteration. In order for there to get parity with mental health, we had to frame mental ill health as a set of diagnosis that is something separate from other people who don't have mental ill health. And in reality, all our mental health is on this spectrum, that without a really clear diagnosable, there's no blood test you can do for depression, there's no brain scan that can tell you're experiencing bipolar disorder. So it's on a spectrum, and it's fluid. And I don't know if you saw in The Guardian that there's this really, you wouldn't, if you had a plant and you put it in really bad soil and it wasn't getting watered and there was no sunlight and then it wilted, you wouldn't call it plant wilting syndrome. You would just say you're not giving that plant the conditions it needs to grow. And so much of mental health is an expression, as you've just said, of those social conditions. And that's why the point about social prescribing is really important, because if the source of the problem is social, environmental, psychological, and economic, then the response has been almost entirely for the last 30 years pharmacological, and that's why the talking therapies is so important. So we've got to get the solutions to fit the problem. So the problem needs to be rooted in the conditions of people's lives, and that's why social prescribing, music, running, should be transformative, as well as access to really high quality clinical service when it's needed, but that's in a very sort of smaller proportion. Yeah, I think we're all in furious agreement, violent agreement.
Right. Chris, wrap us up.
Sure. So I'll try to sum up that furious agreement. I mean, my reflection on the music point was that I'm a massive fan of universalizing good public health interventions. I think that's the promise of social prescribing. I think if we're being at our most ambitious, we put health and wellness as the heart of the progressive project, the purpose of social democracy, and we think about things through those lenses, and we come up with wildly kind of new frontiers of how we can improve health. So I think it's hugely important research and points towards the kind of broader definition of health and wellness that we can have. Which brings me, I suppose, to my second reflection, which is, I think your question touches to a fundamental kind of question in the health world at the moment between, do we have a narrow definition of health, which is your kind of paradigm of, very clinical diagnostics, the kind of things that we find familiar, or do we have a much broader definition of health, which is sometimes called a spectrum of wellness, but brings into conception your social justice argument. And I think that opens up a really interesting conversation that we need to have in the 21st century around what the role of the state is. We have gone from a period where the state had very little involvement in taking a role in good health. It kind of did a bit in the poor laws, it did some workhouse stuff, but not really very much. It was very inconsistent. Some of it was still within the voluntary sector as well, so it was a very patchy thing. You get this kind of slower than conceived evolution, national insurance and the First World War, then the NHS. But the NHS is a big state intervention that runs on the narrow definition, and the realities of our health need us to come up with a conception of health for the broad definition. How does that change state intervention is a really big question, I think. That's the only way that we'll get to grips, I think, with the realities of health, the change in how health has affected people since the 1940s. That's a big fundamental question for us. Keep an eye on Pathwork, going through the Commission on Health and Prosperity. We'll be taking that on. But I think the debate is absolutely the right one and points us to a question of what the future holds that is just vital. Hopefully that sums it up.
Yeah, we started with mental health and we've ended up with reforming states and markets. We'll get there. Thank you, everyone.